Hello, my name's Rachel and I'm the lead radiographer for Interventional Radiology. Interventional Radiology is an umbrella term for minimally invasive procedures carried out under image guidance. You may hear us refer to it later on as IR. Leeds is one of the biggest IR services in the region and also the country. And we're also very unique and lucky because we serve a multitude of specialities all under one roof. Our tertiary referral status often means we're at the centre of complex patient care. Within radiology theatres, where you'll be spending the majority of your time, we see approximately 5,000 patients a year. Each year there is a greater demand for our services as technologies and treatments advance. The advantage of our minimally invasive procedures mean a reduced risk to our patients, a reduction in bed stay and associated recovery times, overall improving our patient experiences. I've worked within radiology theatres for 15 years, starting as a specialist radiographer, vascular sonographer, team manager and now lead. My current role is to maintain and monitor service delivery, but also to develop our service so we can continually meet the needs of our patients whilst providing excellent quality of care. We are committed to optimising our patient pathways and experiences, and we recognise that one of the best ways to do this is by investing in our people. We recognise the importance of education and advanced practice and hope to extend not only our number but our scope of practice too. I'm now going to hand you over to some of the team to tell you a little bit more about who we are and what we do.
Hello, my name's Simon Gulliver. Together with Ian Medlicott, we are the senior charge nurses for Interventional Radiology theatres. I started my IR journey 10 years ago as a newly qualified nurse. What attracted me to the role was being able to be exposed to so many different specialities, such as vascular, neuro, renal, oncology and many more. Secondly, it was being able to care for patients on a one-to-one basis, much different to the ward environment. What stood out to me progressing through my IR journey was how incredibly proud I would feel to be an IR nurse, not only as an individual, but collectively as a team. We work across 2 hospitals. These include St James's University Hospital and Leeds General Infirmary. Together they form part of the Leeds Teaching Hospital Trust. These include the Interventional Ultrasound Department and the Interventional Oncology, which forms part of the ablation service. Whether you're a newly qualified or an experienced nurse, you will have a varied and exciting role, which will challenge you to develop new skills and knowledge with the support of the team and colleagues. The 3 main roles as an IR nurse is caring for patients undergoing local anaesthetic procedures. Firstly, caring for the patients pre- and post-operatively within the recovery area, ensuring they are recovered before returning home or to the ward. Secondly, caring for patients in the theatre environment, ensuring that they are monitored and supported throughout their procedures. A large proportion of our patients have their procedures done under local anaesthetic, which means that you can build a really good rapport and support the patient verbally, which is something I personally really like. And lastly, scrubbing to assist the radiologists in carrying out procedures. As an IR nurse, you will have the opportunity to develop your skills in giving conscious sedation to patients who require them as part of their procedural care. There are exciting times ahead with the recent development of our nursing workforce strategy, and we are looking for driven and enthusiastic nurses and ODPs, which very well could be you. Come and join our diverse team as we work together to support the development opportunities and work towards the very best in patient-centred care.
Hi, my name is Tyra Mahmood. I am a sister in Interventional Radiology at Leeds. I have worked here since qualifying from university. One of my favourite aspects about working here is definitely the range of skills we're constantly learning. I still feel like we're learning and I've been here 6 years. Part of my role as a manager, I'd say I love at supporting staff and their ideas.
Hi, my name is Mariam. I came to Interventional Radiology after completing my return to practice course. My main pull to IR was the family-friendly hours, which is 8 to 5. And we do an on-call service, which is unusual in nursing. So it was the different type of nursing that attracted me to IR. I have now progressed to being patient flow coordinator, which is a brand new role in our department. It involves talking to patients pre-operatively and preparing them for their operations by cannulating them or starting pre-hydration. The main aim of the role is to adequately prepare patients so as to decrease cancellations and provide a seamless flow of patients through IR whilst optimizing theatre usage. Our role provides a vital link between the different departments and makes IR more visible. So far, the role has been met with great positivity from both the MDT and patients.
Hello, my name is Amanda Yang. I'm the Clinical Nurse Educator for Radiology Theatres. I came to work in the Interventional Radiology department after completing my return to nursing 5 years ago. The job advert caught my attention because it offered me the opportunity to retrain in a specialist role as an IR nurse. My current role as a clinical educator involves training and supporting all new starters, student nurses and existing IR nurses. We offer all our new nurses a supernumerary period of about 3 months. The fast-paced environment in which radiology nurses work in means that it's a steep learning curve for all new starters, but it's also one which is immensely satisfying and rewarding.
Hi, my name is Dan Carter. As a Band 6 specialist radiographer, we work from 8 till 5 and cover roughly 5 on-calls across both the LGI and Jimmy's hospitals. Part of the Band 6 role, we also take on board advanced clinical practice. This includes catheterisation, cannulation, checking the controlled drugs, and also assisting the nurses in setting sterile trolleys. One of my favourite parts of the job is a procedure called mechanical thrombectomy. The Interventional Radiology department is very welcoming, friendly and open to new ideas and new ways of working.
Hello, my name's Chris Hammond. I'm a consultant vascular radiologist and I'm currently clinical lead for Interventional Radiology here in Leeds Teaching Hospitals NHS Trust. One of the things I enjoy about Interventional Radiology is its diversity. We're central to the functioning of many clinical services here in the Trust. We treat patients from paediatrics to peripheral vascular disease, from trauma to transplantation, and from oncology to obstetrics. We treat acute patients with immediately life-threatening emergencies and elective patients who we've seen in clinic with planned procedures. One of the most satisfying things I find about interventional radiology is the immediate feedback you sometimes get when an acutely unwell patient is being treated by you on the table and they get better straight away. For example, when you've stopped their bleeding point, immediately gets better. Or perhaps my neuroradiology colleagues who treat a patient with stroke and we find the patient starts to immediately move their arm, their leg, their speech comes back or they wake up on the table. It's immensely satisfying. Interventional radiology is a relatively small team and we work very well together. We've worked hard to flatten hierarchies within the department. Every member of the team is valued and every member's opinion is taken into account. Interventional radiology is a very collegiate place to work. There are lots of positive changes being undertaken at the moment in interventional radiology. In particular, we're undertaking a large workforce expansion. This will allow us to increase our capacity, undertake innovative new procedures and improve the work-life balance for all our staff. There's also some exciting developments happening in the pipeline with the new estate, with all our procedures and services on one site at the St James's Hospital, complementary to other services remaining at the LGI. The Interventional Radiology Department is an exciting place to work. We're looking for enthusiastic members of staff to join us. We hope you will.
Hello, my name is Fee. I'm the first trainee nursing associate in Interventional Radiology Department. I've started there in 2019 as a Band 3 and the department has given me the opportunity to progress into a nursing associate role, which in 5 months' time, when I get qualified, I will be doing a supportive role and I get more involved in scrubbing, circulating, handover patient, looking after post-procedure patients. I am ever so grateful so far with my experience because the department, from the management, work colleague have supported me a lot. It's an amazing team to be with.